Okay,
So,
so you can start.
hello, good afternoon. I'm Dr. Sandeep. Hello, Dad.
Good afternoon. How are you,
So,
doctor?
yeah, how are you doing today? I'm fine. Thanks for asking.
Yeah.
So, today I'm here
Yes,
to.
doctor. I have come to clinic because Jack has a pain.
Yes, yes, yes. Today I'm here
He's
to
limping also.
discuss the problems of Jack. And while taking information from you, I will take some notes. Is it okay with you?
Yes, that's okay, doctor.
Okay. Hello, Jack. So, Jack, I will ask few questions to you also. Okay. So, Dad,
Yes,
so,
yes.
so,
Okay, doctor.
so, Dad, can you tell me what is the main concern of Jack today?
Yeah, today we have come here because Jack is having pain in both the knee joints, and this is going on since almost past 3 to 4 months.
Okay,
And now he's not going to play football also. He's not
okay,
able to play because of the pain,
okay.
and I want to have some good solution for this problem. I don't know
Yes,
what's wrong going on with him.
yes. Okay, I can understand your pain and your concern also. So, can you tell me how this pain started actually 4 months back and how it progressed over the period
Yes,
of last 4 months?
yeah, over the period of last 4 months, it has become worse only. It has started initially with the first in the right knee joint, then it started like left knee joint, and then gradually also it affected the ankles also, and now even the hands also he is feeling difficulty in writing. I feel even he's feeling the
Okay.
pain also on the hands, both the
Mhm.
hands.
Mhm. So, if you want to grade this pain, so how severe the pain is, Jack? If you say like 0 being no pain and 10 being maximum pain, how will you rate this pain, Jack?
uh, it's around somewhere between six
Okay, okay.
5 to 6.
So is this pain is continuous or it comes and goes intermittently?
No, it is not continuous. It's
Okay.
intermittently. So when I'm sleeping and at
Mhm.
rest, it doesn't cause much of
Okay.
the pain and
Okay.
discomfort.
Okay. Okay. And like any part of the day, it is more worse, and in the later part of the day, it's less. Is it like that?
No, when I'm sleeping, I feel a little better, but the moment I started walking or playing, I feel more pain.
Okay. Is there any stiffness when you wake up in the morning?
No,
Okay.
I have
Okay.
not noticed that.
Okay. And apart from sleep, is there anything particular which makes the pain better?
Yes, doctor. I have shown to GP and he gave me
Mhm.
some naproxen, this medicine,
Okay.
and which I am taking. And after that, I'm feeling better.
Okay. So, do you need to take this drug every day or some days only?
Yeah, once in a day I have to take,
Okay. Okay.
almost every day.
Mm-hmm. And do you feel any problem with this drug, like any chest pain or any burning sensation in the chest or any allergy?
Yes, yes. If I take it with empty stomach, I feel some pain in my tummy. So my mom said usually
Mm-hmm.
to take after some food only.
Okay. Okay. Is there anything particular which will make this pain worse?
Uh, yeah, some activity like sports or walking or running or
Okay.
even writing nowadays on the hand. Also, it makes worse.
Okay. So before this pain started 4 months back and today, is this pain associated with any fever any time in last 4 months? Do you get recurrent fever?
Yes, it was there before. when it started. Then it was subsided. I took just only the paracetamol. I did
Okay.
not take any
Mm-hmm.
antibiotics or antibug therapy, and it
Okay.
was subsided.
Okay. Okay. So that can you tell me? Did you notice any change in his skin? Any rash you noticed over his body?
Mm, right now, there is no rash.
Okay. Okay. Any nodules you noticed? Any all over the body? Anytime? Or
You mean swellings?
any swellings you noticed? Did you notice?
No, 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 no. Not particular swelling on the skin, but joint, yes, there is a swelling.
Okay. Okay. So, Jack, do you have any pain in your eyes?
No.
Okay. Any redness ever noticed by you while
Uh,
you were a child?
no. 6 minute finish.
Okay. Okay. Dad, did Jack suffer from any tummy issues like recurrent loose motions or recurrent tummy pain?
No, doctor.
Okay.
He had diarrhea, which was like last 6 months ago,
Okay.
and he was okay after taking this medicine called Flagyl. He took
Okay.
5 days, and it was okay.
Okay.
But after that, there was no tummy pain or diarrhea.
Mhm. Did he report any racing of the heart or any swelling over the legs?
No, so far no racing of the heart. Swelling over the leg is there, yes.
Okay, okay. So, apart from this GP general practitioner visit, did you take Jack to any other specialist or any other treatment did you take for this swelling?
No, actually, so far we were showing to GP, but
Mhm.
now he said we need to meet you, and we need to do some test also. Probably that's why we have come here today.
Okay, okay. Any investigations were done at the GP level?
Yeah, 4 months ago he did
Mhm.
some test. At that time he said tests are normal. There is no infection in the joint, or there is no infection.
Okay.
So we were relaxed, like okay,
Mhm.
all the basic reports, screening reports are okay.
Mhm.
So I was quite
Okay. Okay.
relaxed.
Okay. So, any of the family member had similar complaints anytime before? Do you remember that any of the family members or any of your first degree relatives had?
Yes, Jack's grandfather had rheumatoid arthritis,
Okay. Okay. Uh,
and also he had cataract in his eye.
okay. Okay. So, do you have any idea at what age did he start with this illness? Grandfather.
Regarding home grandfather,
Yeah.
grandfather he started at the when he became old, somewhere around
Mm-hmm.
60.
Okay. Okay. So, I want to ask you how this illness is affecting Jack. Like apart from missing the school.
Oh, it is affecting a lot. He is not able to go for play. He's not
Mhm.
able to play the drums. And
Okay.
even while writing, also nowadays he's complaining pain.
Okay.
So he's not happy at all.
Mm-hmm.
There is a lot of restriction has been
Mm-hmm.
made because of this issue.
Okay. Okay. And do you feel it has affected his behavior, or is he feeling like more depressed nowadays because of this illness?
Yeah, slightly he's feeling low. I feel
Okay.
that, yes.
Okay. And how this disease has affected your family? How your family is coping with this disease?
Yes, as a father, I'm really feeling quite worried.
Mm-hmm.
What can I do? Is there something kind of serious issue is going on?
Mm-hmm.
Is he having
Mm-hmm.
some infection in his body, or what's wrong with him?
Okay.
I'm worried whether he will be back to his normal life or he has to take this painkiller throughout the life.
Okay, okay. So that can you is there anything particular which I have not asked and you want to tell me, which will reflect on the treatment, or which will help us in better diagnosis?
No, so far. So your 10 minute is done.
Okay.
You can do now.
Hmm.
2 minute you have
Hmm.
to summarize.
Okay. Today I have taken history from Jack, a 9-year-old boy, who is suffering from pain in multiple joints since last 4 months. The pain initially started with the right knee and then subsequently involved multiple joints like spread to left, then ankle. Now he has also pain in the mm, hands also, which is affecting his routine activities. The pain is moderate and which gets relieved with the sleep. However, there is no stiffness. For this pain, the child is taking naproxen and then gets better with naproxen. However, because of naproxen, he is having some uh, acid peptic issues. Initial investigations done at the GP level are normal. As per the family history, grandfather has had arthritis and also suffered from cataract. This disease has affected Jack by he can't go for playing, affecting school. Now difficult in writing also, and he's feeling low because of that. And father has concerns regarding the chronicity of the disease, like whether this disease will remain for lifelong, and whether child need to take lifelong medications. Also, there is no
Okay.
rash or any swelling in the eye noted, or there are no JIT or cardiovascular symptoms associated with this joint pain.
Okay. So, what do you think? What's your impression after taking the history? What do you feel Jack is suffering from?
After taking the history, the child is having multiple joint involvement, probably a systemic illness. Most probably, considering the family history and the onset duration progress of the illness and the age, most probably is a polyarticular rheumatoid arthritis is my first differential. Secondly, as this disease has started with the fever, could be a reactive arthritis. However, it is usually affects single joint only.
Okay.
Then also,
So,
then
fine.
arthritis.
Fine. Do do the uh, musculoskeletal examination of PGAs for both upper and lower limb.
Okay. So I have here question one, like we have already taken history from the parent and the child. Do we have to introduce ourselves again?
No, again, no need to introduce. Just start like without, just say only like I'm going to examine, and then you start.
Okay. Hello, Jack. Today, I thank you for allowing me to examine today. Uh, we will do some movements and it will involve some walking. Is that okay with you?
Yes, 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 it's
Okay.
okay.
Dad, can I examine Jack?
Yeah, you can go ahead, doctor.
Okay, okay. I will ask a few screening question initially. Jack, are you sore anywhere?
Yes, I have little pain on
Okay,
both the knee joints.
okay. And is there any difficulty in dressing, undressing?
Mm, yes, there is some difficulty.
Okay. And do you have difficulty in going up and down the stairs?
Yes, doctor.
Okay.
I am slightly limping while
Mhm.
climbing the
Okay.
stairs.
So I'll ask the child. So shall I do like a virtual exam or like a question answer? Like I'm not sure.
Same like virtual, you have to ask the things, and
Road.
wherever it is finding, I will tell.
Okay. So okay,
But you have to tell me what you are looking for.
I'll ask the
Starting.
child to Jack, can you walk for me? I'll ask the child to walk and observe his gait.
Okay, so his gait is normal but slightly limping on both the side.
Okay. Okay. So then I'll ask the child to stand straight and I will examine for his general appearance, growth, nutrition, dysmorphism, and any
One
equipment.
by one, one by one.
Okay.
And general appearance, he looks slightly tired,
Okay.
and nutrition, he looks undernourished.
Okay. And then any dysmorphic feature or any equipments in the
There is no dysmorphic feature.
any equipments in the surrounding.
No equipments in surrounding.
Okay, I will examine the child from front and back. I will take the permission to examine the back of the child uh, before getting getting his back exposed, and I'll check for any scoliosis over the back. Then I will ask the child to bend down and observe for the spine, and asked him to stand again and also simultaneously palpate the spine for any tenderness. Then I'll ask the child to sit on the couch, and I'll do Pigal's maneuvers in the upper limb first. Initially, I'll ask the child to make a circle with the thumb and index finger. Then I'll ask him to touch all the tips of the finger. Then make the fist and then make a star of this. Also, simultaneously, I will examine hand for any.
What you are looking for, making a
I'm
fist and star?
I'm looking for any atrophy of the muscles, swelling of the joints, or any scars, or any swelling over the joints, or any pain
Okay.
when he is doing these movements.
There is difficulty in doing this movement, and there is a slight atrophy, and but there is no scar.
Okay, no swelling also
There is slight swelling also in
near the
the
joints
interphalangeal
of the
joints.
interphalangeal. Okay,
Yes.
and any nail pitting is noted.
No.
Okay, any pallor.
Yeah, he looks pale.
Okay, then I'll ask him to stretch out his hands, and then again I will tell him to pronate the hands. I will check for the pronation, supination, and extension of the elbows. Then I'll ask him to raise his hands above the shoulder, pointing to the
Yeah,
sky.
that he can do. He's raising the hand above the shoulder.
Okay,
There
and
is no
the
pain.
hands over the back of the head.
It's fine. He is able to do.
Then neck movements, front flexion, extension, then touching back
Also,
here to the shoulder,
yeah, he's able to do.
and lateral looking at the sides. Then I'll ask him to sleep on the bed. Then with adequate exposure with prior permission, I'll observe his legs for any
Yeah,
gross swelling, atrophy, scar, skin
there
color.
is a swelling on both knee joint,
Okay.
and also slight swelling on both ankle. Also, you feel there is a slight uh, tenderness also in both the knee joint.
Okay, I'm just still observing actually. And the I will notice the posture, contractures, scars, color of the skin, any redness, inflammation. Then I'll check. I'll ask first to flex the child. Is leg and see whether he is able to do. Then I'll check the internal and external rotation at the hip joint, like by flexing the hip joint at the 90-degree and moving the leg laterally and medially to check the internal external rotation. And at the knee joint, I will check the flexion extension movements and the patellar tap.
Doctor, I told you there is a tenderness in the knee joint. So don't do this.
Okay,
He cannot do, if you will flex his knee, he will cry. So don't do
okay,
that.
okay,
But you can ask him to move the hip, it's fine.
okay, okay. Then if child allows, I can do patellar uh, tapping test, like by
Uh,
to check for
no,
the
you can.
joint diffusion.
I prefer you can just touch instead of doing the tapping because he's complaining of pain.
Okay, okay. Then as there is a gross swelling in the knee joint, as the child is in pain, so detailed examination. Uh, if there is permission from the examiner or child, then detailed examination of the knee joint.
Hmm. Okay. What you would like to, you can describe what you would like to do
In knee
other than
joint,
this in the knee.
apart from knee, the inspection look inspection the swelling around the joint. Uh, uh, then,
Okay.
uh,
So 8 minute finish. Okay.
mhm,
Give me your differential diagnosis and present your case.
mhm. Today I have examined 9-year-old Jack, uh, who is who looks tired and undernourished. I would like to plot him on appropriate growth charts. On musculoskeletal examination, there is pain and swelling in the interphalangeal joint, and also there is a pallor. Also, movements are restricted at the in the hands. Uh, at the elbow and shoulder joints, there was no restriction of movements was noted. In the lower limb examination, hip joint, there was no restriction of movement noted. At the knee joint, there is significant tenderness and swelling of the joint noted, and restriction of movement because of pain. Uh, and also there is some swelling in the over the ankle joint.
Okay. So, uh, what's your impression?
Okay, after considering all the history and examination, child is having multiple joint involvement along with involvement of small and large joint. So most probably it is polyarticular rheumatoid arthritis.
Okay. What's your other differential diagnosis you would like to consider?
Initially, I had in mind reactive arthritis. Also, I would keep in mind other autoimmune diseases like systemic lupus erythematosus.
Okay. So, what investigation you would like to do?
Mhm. Here, initially, routine investigation like complete blood count, where I will expect some pallor and CRP, which will also be expected to be raised because of inflammatory disease. ESR would be high. Uh, Running out of time.
Mhm.
Okay. So also,
Okay.
apart from that, I would like to do investigations such as ANA, ANA, dsDNA, and
Mhm.
rheumatoid factor. Also,
Okay.
if possible, joint fluid examination, aspiration
And
using.
how you will manage after doing this test, what you will advise and what medicine you will give.
Okay, after complete physical examination, I would like to involve multidisciplinary team like physiotherapist, occupational therapist. I would like to have is a detailed eye examination, and also involvement of rheumatologist. Treatment wise, initially non-steroidal anti-inflammatory drugs to control the pain and inflammation, and steroids like prednisolone to cover up initially and fast on the recovery. Later, we may consider adding disease-modifying anti-rheumatic drugs like methotrexate, and further treatment will depend on the response of the child to the medications.
Okay. So time's up now. Uh, Sandeep, really, you did very good.
अरे
I
नहीं
mean,
बाबा
I
यार.
was thinking, नहीं अच्छा किया, really. सही में अच्छा किया.
थैंक
पूरा पिगास करना मतलब ऐसा लोग ऐसा तो नहीं था कि सिर्फ लोअर लिम्ब पिगास करना है.
लेकिन initially
So you,
if the child is in pain, obviously like during examination we will do it, but like in virtual examination we tend to forget the things, yeah, like we have to
yeah, true.
position.
That's what. No, it is a lengthy.
I think Dr. Sandeep, like, I'm not sure because this is a new exam pattern, but if I think you can see the examiner,
Mhm.
despite saying him that flex your ankle, just tell him that do like this for me, what I'm doing, because he can see you in the camera.
Yeah, that,
Can't you?
yeah, that's like popping the movements will be faster also, but
Yes, because
Yeah.
you
whether
spent a
role
lot of
player is
time on Pigalle.
whether role player is there or
Yes.
no, I don't know. Like, if role player is there, then we can ask. Cannot ask.
No, examination role player will be up to history only. After that, there is no role player.
Then we have
I
Then
think I think
examination,
I think we can start giving feedback right from the history first, then we come to the examination portion.
yes. Yes,
If
go
I'm
ahead, Dr.
allowed,
Tahir.
okay,
Yeah,
right. Thank
sure.
you. I think most of the time, Dr. Sandeep, you spent on pain. You spent a lot of time on pain. This is a focused history. I think you should not spend that much time. Although, luckily, finally you completed, but in the middle you left few important things just because of this pain.
Mhm.
Although it was an excellent attempt, I'm sure I cannot present it like this the way you did in few minutes,
Dr. Tahir, you can
focused
criticize,
history.
huh? We are. I am actually more interested in criticism.
Yeah, oh,
But
I'm coming to
it was
that. I'm
good.
coming to that. It should be a burger approach. Initially, it will be soft. Now, in the middle, it will be a hard part. So now come towards the. This was a good thing. Good thing you cannot hide. You have to tell the good things. Now we come to the things which are missed. Actually, I think like if you are thinking that this is a JIA, so you should keep in mind the things which are important for the classification of the JIA. Like, did you ask about the morning stiffness?
Yeah, I asked
Did
morning.
you ask about
He asked.
hotness? Did you ask about the? I think you ask about the pain on movement. You ask, yeah, he asked that thing, yes. And the other thing, the most important thing which is missed, I think, is rule out important differentials in history. Because how can you say it's okay, you put your differentials at the end, but in history you also have to write the differential, because it can be SLE, because you did not ask about any rash. It's a long. It can be SLE.
I
So the
asked
important
that.
thing is, so the important negatives to me in this case. Sorry.
Actually, I kept in differential in my mind like GIA, SLE, reactive arthritis, rheumatic fever,
Mm-hmm.
and inflammatory bowel disease. For that, I asked regarding the gut disturbance, diarrhea, and I asked
Okay. Sorry. Maybe. Then I missed that portion. But
infection of the
important thing
heart.
is, yes, you need to.
Actually, actually your voice is actually my network or your network?
Yeah, you need to ask about, I think, three important different. Is it okay now?
Yeah, it's okay now.
Hello.
Yeah, it's
Okay,
okay.
I think you need to rule out three important differentials at least.
Mm-hmm.
One is the SLE, in
Yes.
which you need to ask, is there any rash on the face, or is there any problem in the kidney, is there any swelling of the feet, or is there any blood in the urine. So this will rule
Yes.
out the SLE.
Yes. Yes.
The other thing is about, as you said, chronic diarrhea history with a blood in it, with a pain abdomen associated with joint pain, to rule out IBDs. And of course, asking about the height. Is there any concern about the shortness of the height or anything?
Mm-hmm.
Then you need to ask about juvenile dermatomyositis. I think this is also very important
Right.
differentials. So
Mm.
you need to ask about any rash appearing underneath the eyes or over the lids, or any abnormal things on the back of the hands.
Right.
So I think this is important.
Right.
And if there is weight loss, so you also have to rule out malignancy.
Right. I really forgot of this. I thought IBD
Uh,
and inflammation and vessels.
the sound, your sound is very low.
Hiren,
So I
am
don't
I
know.
audible?
It's
Hiren, whose network issue? Hello?
No, my network, I
No,
think
no.
yeah,
it's
Hiren,
okay. I muted also myself
Can you tell
to,
Dr. Hiren,
doctor, my
but I
network
Dr.
have
Hiren
some
is
disturbance. I have some disturbance because some drilling is going on. So I will just mute myself.
I didn't know.
yeah, it's actually drilling. My daughter, she's having a cycle.
Okay, please continue. Please continue.
Yeah. So I think it was a very good attempt. Regarding one thing, another which I'll give the feedback is regarding the eye thing. You did not focus a bit more on the eye thing. Regarding, you should have asked about the follow up. Did you have any follow up with the, I know you asked about, did you any other doctor saw
Yes.
you, but I think you need to hit the nail
Okay.
on the head. Like, you need
More
to ask
particularly.
that, did you follow up with any eye specialist,
Mm.
especially for eye concern? Is there any problem with the vision?
Mm.
Have you
Especially.
ever done the jelly scan of the heart? What
Mm.
was the result? If they say yes, what was the result? Have you any idea?
Mm. More
Have you,
clarification should have been needed.
yeah, more like this.
Yes, yes.
So you ask about the drug history. Very nice, it was excellent drug history. I should not add anything more. Then you the other one important thing, I think, if we discuss more and more, so on the day of exam, at least if we
Right.
remember, I think 30%, that will be enough.
Correct. Correct.
So one thing which is really important to me is that with these medications, what do you feel? Is there
Right.
improvement, or what do you think? You are going down the hill, or you are getting better with these medications?
Mm.
So,
Very nice.
what's your opinion, Jack?
Very nice.
Okay, that's very nice. Then we go towards the complications of the disease. This is also very important. The complication of the treatment and complication of the disease, because history, it's a very tricky part.
Right.
And especially if you are having chronic illnesses, then this part is very important, that complication of the disease and complication of the treatment. So complication of the disease, I think the most important is that, is there any uh,
Deformity.
deformity of the joint? This is important. And eye problem. I think these two are the most important thing, if you are sure that this is a
Right.
JIA. Then you